Stop playing games, girl, we grown up. Us, I know.
Hi, what time was your appointment? Yeah, I'm about to check you in. What's your name? 1 second. One second, please. I'm getting my laptop over so I can check you in. Okay. Last name? Alright, today we have you scheduled for a cranial nerve exam. What's a cranial nerve exam? I'm not Googling it. It's a when you check the cranial nerve. But like if you want the science answer, then yeah, I'll Google it. But it's yeah, when you check the cranial nerve. Google says a cranial nerve examination is a systematic 12-step neurological assessment used to evaluate the function of the cranial nerves, primarily identifying deficits in the head, neck, and facial structures. That's what Google says. See, it's the same thing I said. It's a cranial nerve exam. So, who's the doctor near you? All right, so let's start. We're gonna start with your vision. How many fingers am I holding up? 3. It's a little concerning. Maybe you're not good at math. That doesn't determine if you're failing the cranial nerve exam just yet. But these are 2 fingers. And here are my other 2 fingers. Now, here's how the test is gonna go. When they leave your line of vision like this, I want you to tell me, okay? But it's gonna be much slower than that. That was just simple, okay? Good. You said they left already, okay? Good. A little early, but pretty good. Way too early. No offense, but do you have a lazy eye? Is it this one? It's this one. Why wouldn't you tell me that before starting the vision test? If you didn't feel like it was important. That's okay. Okay, now I know I'm going to watch this eye, but I'm seeing issues with it. Are you sure it's not this eye? Okay. All right, I'm gonna do a dull and a sharp test. I'll be right back. Okay, the end of this lip gloss is dull. See, no pain. This is sharp. It's a pen. So I'm going to poke your arm. Give me your arm, please. I'm going to poke your hand. And I need you to close your eyes and tell me, is this dull or sharp? You said dull? Okay. Sharp? Okay. Dull? Okay. And sharp? Okay. Alright, let's move on to the next test. So I want you to keep your eyes closed. We're going to start with things I want you to smell. And, yeah. I want to say there's no wrong answers, but there is. You have to stay in, like, the ballpark of the notes of whatever you're smelling. But it doesn't have to be, like, every singular note of what's in here. If you get one note that's what's in this, then you're good. So, smell that. You said it smells like sandalwood. Okay. Smell this. Hold on. I take the top off. Oops. Not too loud. Sorry. Smell that. Great. Okay. I think we can stop. Well, Let's do a couple more tests. I'm gonna do sound. So I'm gonna put these headphones on you, and you let me know when you hear sound. Okay, you should be hearing. You don't hear sound. Okay. Still no sound. Just give me a nod when you hear something. So you heard nothing. Okay. 1 second. Now, you know I got my degree out of Temu, so usually like a official certified doctor that went like to university or something would use a flashlight here. I'm gonna use a lighter. So I want you to follow this lighter very, 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 very closely so I can monitor your eyes and make sure they're working how they're supposed to be working. And then we're gonna do like a little check-in checklist, okay? So follow the lighter. And it's gonna progressively back up. You're pretty good. All right, now I'm gonna check your depth perception. So we're going to, that scared me, sorry. We're going to watch you're going to watch it get closer, and then you're gonna watch it back away, okay? So first we're gonna start with closer. Keep your eyes on it as it gets closer. All right, now watch it as it backs away. Closer. Now backing away. All right, let's do our little checklist of other miscellaneous stuff. So how are you doing mentally on a scale from 1 to 10? 10 being you're the best you've ever been, and a 0 being that you need some help, and if you could check yourself into a mental asylum today, you would do so. You're a 7. Okay, that's pretty good. Physically, how are you feeling? Are you having any pains? Are you having any back pain, arm pain, leg pain, whatever, anything like that? Any problems you're experiencing? Any eye pain? A little bit of back pain? Are you working out a lot? Maybe you've like stressed that muscle a bit too much. Is that what it is? Okay, can I ask you something that might seem like it doesn't relate to what I just previously asked you? How much time are you spending on your phone? What's your screen time? 14 hours a week? Okay, that's pretty. 14 hours a day. Okay. Uh, it, here's what I need you to do. You need to listen to me because it's serious. You need to go in your settings and set up a screen time limit. You should not be on your phone for 14 hours a day. Maybe if you were averaging 14 hours a week, I could see that. A lot of my other clients have that much time, but 14 hours a day is concerning. How are you sleeping? You're not sleeping. Are you doom scrolling before bed every single night? For how many hours? Until the sun comes up. So when do you lay down to go to bed? At 8. Okay. So here's the honest truth about your cranial nerve exam. You did fail tremendously. So I'm actually going to set you up with a neurologist. 1 second. Okay, I'm setting you up with a neurologist specialist. And they're going to check out whatever is going on in there. And I'm pretty sure you have something going on with your vision because of the immense amount of screen time you are having every night before bed, and probably the amount before you even lay down to bed. So I'm just sending a reference over to the neurologist, and your appointment will be in 2 weeks from now today, okay? And don't worry, a lot of people, they actually do fail their cranial nerves exams, and it's really nothing to be extremely worried about unless you get to the neurologist and they schedule you for surgery. Then you're gonna need a new brain. But worst case scenario, they just wash your brain. A lot of people, they have to have that done, and that's not that bad. But if you have to get a new brain, they're gonna have to just cut your head open and give you a new brain. And Temu sells new brains, and that's where I got my degree. So at least you'll be getting the Temu brain, and maybe you'll have TikTok brain rot already in your brain. So yeah, they're all set. I hope you lower that screen time, and if you get a new brain, I hope it works well for you. Thank you for coming to see me today, and I'm sorry you failed your cranial nerve exam. It's nothing to worry about. You're going to be fine. I have sent you your reference to your neurologist. Make sure you go see them. This is very important. All right, bye.